And we're back with the Dr. Joe Show. As I pull my collar, this is a very intense conversation. Dr. Joe,
It's
what are we
fantastic.
talking about?
We're talking with Professor Grace Howard about clearly one of the most politicized, divisive decisions, and yet who has the right to take away a decision from a woman, from anyone? Who has the right to do that? So we've got a few minutes left. Professor Howard, what about that?
Yeah, I mean, to me, this, as someone who, like, I'm knock upable, so like it is a really jarring thing that this something that was once considered a fundamental right is now something that I do not have the right to anymore, not a protected constitutional right to anymore. And where I am now in California, I'm safe, but I have friends that live in these states with bans. I have students that live in these states with bans, and I'm really worried about what's going to happen to them. I think we were talking about reasons why people have abortions, and I think that there's a lot of misinformation about this. Most people who have an abortion in the United States are already moms. 60% of people who have abortions have already had one child. And so in a big way, when we talk about making sure people have the right to abortion, we are trying to make sure that families are okay, right? And we look at the reasons that people give for why they have abortions. It's a combination of things. I mean, I'm a free abortion on demand without apology gal myself. Right. But most of the time it's happening in the first trimester, over 90% of the time. And it's happening because we don't have good childcare. It's happening because you can't continue education. It's happening because it won't work with your job. It's happening because you can't afford it. We don't have great resources for families. We have a serious poverty problem in the United States. The maternal mortality rate in this country is really high for a developed country. And because of this decision, we anticipate that it's going to go up a lot. By around 33% for Black women who already have this hugely elevated rate. And so, we're talking about the lives and the families of people who can get pregnant. And then when we look at some of the kind of far-reaching implications of this decision, it's about what rights do people with the capacity for pregnancy have? Because we're seeing these decisions being made on the basis that at some point in the future, you could become pregnant against your will, right? Like being denied your medication for this reason. In the past, we've deprived people of certain kinds of employment for this reason. If you couldn't prove you were infertile, you weren't allowed to work in some of the best factory jobs, for example, right? So yeah, I mean, the implications of this are huge. What it comes down to is, are people with the capacity for pregnancy fully people under the law or not? And with this decision, it was a big push in the direction of not.
Again, I got to say, because a lot of people have images in their head of what an abortion is. So I went to Catholic school for, I'd say, preschool to maybe 5th grade. And I read in our student Bibles, there was a passage about, abortion, about what it is. And it describes the worst case scenarios of a 3rd trimester, like something that no one actually wants. The procedure of, and I won't go into detail on the radio, but it's grisly. And it
can be, yeah.
Well, because this is 3rd trimester.
Yeah.
A 1st trimester abortion is a heavy flow period.
Well, I mean, so what? It takes about 2 minutes if you're doing an aspiration abortion, right? It takes about 2 minutes to actually do the thing. I used to work at a clinic. I was a hand holder at a clinic, so helping people breathe and feel their feelings and do the pain, all this stuff. Most people feel relief after they have an abortion. Most people, some clinics will knock you out, and some patients want that, which I respect. Our clinic didn't do that. People were awake just with ibuprofen, right? So it's not surgical, nothing gets cut, and it's quick, and recovery is not really intense, and it is so safe. It is so much safer than so many other totally common outpatient procedures. Yeah. And yeah, that's over 90% of abortions are.
And that's what I think it's really insulting to think that so many women are these evil witches who want to get pregnant so that in their 3rd trimester, they can have the fully formed baby ripped out and torn apart in front of their eyes so they can sell the limbs to make vaccines.
Yeah.
These
it is
people are a
insulting.
fantasy.
Well, and it freaks people out pretty good too, right? I mean, can you think of anything more horrible? If you are interested in the reality of third trimester abortion, I recommend a documentary called After Tiller. They follow I think at the time, 5 remaining abortion providers who would do third trimester abortions. And you see the things that they do to make the experience as painless as possible for their patients. And that includes, if patients want to, the ability to hold and grieve an intact baby once it's been removed, right? So there are all kinds of ways of managing that. Yeah,
And
the amount of courage and compassion.
You're in favor of that. Like that's.
Yeah. You know, it is like less than 1% of abortion cases. And it is basically always a wanted pregnancy when something's gone terribly wrong. And so parents are in this position of deciding, okay, we can, you know, continue to carry this dying pregnancy, and you'll feel it and you'll think of it and it's in your body at all times, right? Or you can give birth to a baby that will have a short, painful, terrible life, or we can take care of it now.
What do you say to somebody who says that's murder? That's immoral. Can we have a conversation and agree to disagree?
Here's what I would say. Legally speaking, anyway, at least for now, we are not allowed.
How about forget
let her finish. Let her finish.
Yeah.
Well, so because morally, it's hard when we're talking about murdering people. It is hard for us to come to a moral consensus. But I would say that, you know, you're essentially requiring someone to use their body against their will to support the life of another, and that's considered a form of indentured servitude, and that's not legal in this country. In terms of morally, I think most of the parents who are making that decision are making a moral decision for themselves. They are choosing to spare their baby of pain and suffering.
So we're talking about fetuses that are already at risk for profound medical compensation when they are born. Not necessarily a baby that is healthy and ready to go, but these are fetuses that have been diagnosed by professionals that this baby is at high risk for a life of trauma.
And a short one at that, right? Like short, painful. So, I mean, and sometimes it's not even there's no question that the baby won't survive. It's a matter of, well, its heart's still beating and it's inside your body. And so even though you are going septic right now, a reality, right? Mm-hmm. The heart's still beating, so we won't do anything. I mean, a woman in Ireland died. That's one of the things that galvanized the movement there to legalize abortion, right? The hospital couldn't do anything. The Constitution says that the fetus in your body, the heart is still beating. It's a person, and so we can't help you. And so we're going to watch you while you slowly die on this table. She went septic and died from blood infection because of the pregnancy. And we've been seeing this already too. So like not in the third trimester, but ectopic pregnancies. That's a pregnancy where the egg implants somewhere other than the uterus. So these are not viable pregnancies. And most of the time it settles in the fallopian tube and it'll kill you, right? It'll rupture the tube, you'll hemorrhage and die. We've already been seeing cases in a handful of states with bans where physicians don't feel like they can do the medical treatment until they consult hospital lawyers. And there was just a case, they didn't disclose the state, but it was just last week where someone came in with an ectopic pregnancy. They consulted with lawyers for 11 hours before they treated her. And in that time, the tube did rupture and she'd been bleeding out. I mean, it's nightmare stuff.
So
was the baby all right?
Professor, we have a few minutes left and there's so much more to discuss, but the IM approach, and this is still an IM, says because the 4 domains, your home, the social, biological, and ICM, we've been talking about all 4 of these. Because the 4 domains interconnect, a small change can have a big effect. You don't have to change everything. There has been a small change with a big effect. Professor Howard, what small change can you recommend to our listeners as we begin to grapple with the new ruling?
I would say believe people when they tell you about their bodies and their lives. Believe them.
Believe them. Okay. The second truth of the IM, you control no one, you influence everyone. You get to choose the kind of influence you want to be. Professor Grace Howard, what kind of influence do you want to be?
I want to be a caring influence. Just think like human animals, like our fingernails kind of suck and like our teeth aren't that sharp and our knee joints don't make any sense, but we're like good at being together, right? And humanity works when we're together, and humanity works when we care about one another.
Yes, that is very true. Folks, I hope that we can continue this very important discussion, not an argument. Mark is absolutely right. We need to be able to respect each other, value each other, so we can trust each other with our points of view. This is how we come together as a community, as a culture, as a species. We all want the same thing, to feel valuable. My concern is that when someone's rights are taken away, where is their value? And I'm not saying one way or the other, but we are in a position right now where we have a country that must come together. Professor Howard, thank you so much for being on the Dr. Joe Show tonight.
Thank you so much.
Barry, we'll see you next week.
Stretch the canvas, brush with